So what can be done to educate passengers both before and while they're on board on proper precautions to avoid transmission of the virus?
Well, I think that there are some things that the cruise ship operators can do to educate passengers before they arrive to the ships, as well as when they're on board the ships. And we've learned a lot through other pathogens of concern on cruise ships like norovirus. So I think they have some history with understanding how to properly educate passengers and their crew members on the risks of transmissible communicable diseases. I think under the CSO, there's requirements while they're on board the ship to educate passengers and crew on the proper wear of face masks. Also, there's a requirement to educate the shipboard population on the physical distancing requirements, as well as other public health protocols. There's also a requirement to post signs and messages in highly visible locations to reinforce the public health expectations. And traditionally, the cruise ship operators have conducted public service announcements during the daily briefings of both passengers and crew by shipboard management to ensure the public health messaging is clear and concise and is consistent. So that's also published in their daily newsletters also. Obviously, proper hand hygiene practices is vital to the control of any communicable disease on board the shipboard environment. And educating passengers and crew in the proper reporting of symptoms of any communicable disease, but of course of SARS-CoV-2 infection to cruise ship medical staff is something that needs to be reiterated consistently during the course of the voyage. Now, before a person embarks on a cruise, I think it's important for the cruise industry to educate them through the different means of contact in preparation for boarding the ship of what the expectations are in terms of public health prevention strategies.
So we know we have criteria for things like norovirus for reporting cases, thresholds. Are there any thresholds established for reporting COVID cases during a cruise?
Sure. There's requirements, obviously, to report any of the symptoms that are consistent with SARS-CoV-2 infections or COVID-like illness as well. That's outlined in the framework also. Typically, when something is considered to be an outbreak, usually that's 2 or more laboratory confirmed cases. In this case, shoreside, that is specifically what the definition is of an outbreak. That is 2 or more laboratory confirmed COVID-19 cases linked and with linkages to establish that, with linkages outside of the case investigations and contact tracing. And during that contact tracing, the identification of 2 or more contacts with active COVID-19 infections. So contact tracing is important to that case definition and outbreak definition as well. Also, under the CSO, for simulated voyages, the CDC has established a threshold for termination of the voyage. This is an operational consideration. And the CDC advises that a voyage be terminated immediately if 1.5% of COVID-19 cases are detected in passengers or 1% is detected in crew. And the CDC advises that these thresholds are also subject to modifications based on the lessons learned. Of course, this is an ongoing pandemic, so as new science comes out, this is subject to modification. But currently, that's what CDC is using as the thresholds for termination of a voyage. They're subject to, obviously they'll be subject to an investigation, and that would be based on CDC's recommendations and requirements.
And that leads me to ask about isolation and quarantine. Can you define the difference between the two terms?
Sure. Quarantine is the separation of people who are exposed. They aren't showing symptoms at this point, but they're exposed to, say, a COVID-19 case. And quarantine is designed to separate those individuals from the general population so that they could be evaluated to determine if they develop symptoms of the disease. Quarantine is not often used as a disease control strategy and is actually reserved for a list of diseases that are determined to be quarantinable. Now, SARS-CoV-2 or COVID-19 is listed as a quarantinable disease and is actually published in a series of executive orders. Isolation, on the other hand, is reserved for confirmed or probable cases of a communicable disease. In our case, of course, that's COVID-19. Isolation includes measures that would be taken by the cruise ship operators to ensure that the separation has occurred between passengers and crews who are infected and are displaying signs and symptoms of the disease, including if they have tested positive for SARS-CoV-2. So that's the difference between essentially a quarantine and isolation.
Thank you.